Social welfare policies in the United States have helped people for decades, but few know the history of these programs that serve a large portion of the population. Social programs got their start in 1935 under the leadership of President Roosevelt and Congress, resulting in the passage of pioneering Social Security Act. In response to the 1929 stock market crash, the federal government created programs for 40% of the national workforce, including the elderly, vulnerable children, and families who were sliding into poverty. It is important to note that prior to 1935, the needs of vulnerable populations and immigrants were being addressed by local settlement houses and other faith-based nonprofit organizations with minimal state and federal government involvement. The Social Security Act policies continue to this very day through programs such as unemployment insurance, aid to dependent children, maternal and child welfare programs, retirement insurance for the elderly, Social Security, and general welfare programs for needy adults. During World War II, President Roosevelt turned his attention back to the safety net by proposing for a second Bill of Rights, focused on providing adequate food, housing, and recreation, access to a living wage, and access to adequate medical care for all citizens. But Roosevelt died before he could realize this idea. In the 1960s, the safety net was expanded. President Johnson and Congressman Wilbur Mills played major roles in the congressional enactment of the 1965 amendments to the 1935 Social Security Act in the form of Titles 18, Medicare, and 19, Medicaid. Medicare insurance provides medical care for everyone over the age of 65, and Medicaid is a poverty program that provides medical care for eligible poor family members of any age. Building upon the ideas in President Roosevelt's proposed Second Bill of Rights, lawmakers attempted to address issues of housing and food insecurity by establishing the Federal Department of Housing and Urban Development, passing the Food Stamps Act, and passing the Housing and Urban Development Act. The creation of these programs paved the way for today's Supplementary Nutrition Assistance Program, SNAP. The safety net was further strengthened with the passage of the Older Americans Act of 1965, creating a local network of services for the elderly, along with the 1967 amendments to the Social Security Act that expanded coverage from dependent children to Aid to Families with Dependent Children, AFDC. In the midst of this tidal wave of federal legislation, it is important to note the passage of the Civil Rights Act of 1964 and the Voting Rights Act of 1965 that greatly impacted the populations being served by the safety net programs. In 1972, Congress replaced the categorical federal-state programs for the vulnerable populations, including the needy elderly, blind, and disabled, with the Federal Supplemental Security Income SSI program. However, the following decade saw some reversals. For example, by the end of the 1980s, 57 social service programs were reduced. AFDC roles were reduced by 17%, and over 1 million people lost access to food stamps. But at the same time, Social Security benefits for retirees were adjusted to inflation that helped to increase monthly payments. During the economic boom of the 1990s, increased attention towards access for the disabled led to the passage of the Americans with Disabilities Act, ADA, of 1990, that called for public accommodation with regard to use and access of public spaces for those that were legally disabled. In 1996, the Personal Responsibility and Work Opportunities Act was passed, creating the Temporary Assistance to Needy Families Program, TANF, that called for TANF participants to work, placed lifetime limits on program participants, and added significant state and local administrative and oversight requirements. The attempts in the 1990s to create universal health care for all the uninsured failed, But the Children's Healthcare Program was expanded in 1997. Despite the significant collapse of financial and housing markets, called the Great Recession in 2008 and beyond, the Affordable Care Act passed in 2010. The Affordable Care Act, ACA, placed increased attention on the social determinants of healthcare, where housing, employment, education, and transportation impact the health of people in need. The passage of the ACA represented one of the most significant expansions of the safety net since the 1965 amendments to the Social Security Act of 1935, Medicare and Medicaid. It represents an opportunity to connect multiple community resources related to health and social services, and thereby impact the social well-being of those in greatest need. As described, our social safety net has been designed, expanded, and strengthened over the past 80-plus years to address the unmet needs of children, families, and the elderly. The design phase of the 1930s included, for the first time in our nation's history, government supports for children, families, and the elderly. By the 1960s, the expanding economy and the changing civil rights environment provided new opportunities to address health care for the poor and elderly, food and housing programs, and many others. By the 1990s and beyond, we passed the most sweeping legislation since 1935 related to reforming both our welfare and healthcare systems. However, there is much unfinished business in the years ahead when it comes to increasing the access to healthcare, providing living wages, developing affordable housing, and serving the undocumented.